Welcome to this explainer. Today, we're totally bypassing the marketing hype and those flashy energy drink labels to decode the actual botanical and pharmacological science behind one of the most famous plants in the world. Yep, we're talking about panax ginseng. Let's look at the hard data. Here's how we're going to break it all down today. First, we'll meet panax ginseng. Number 2, the science of ginsenosides. 3, clinical features and uses. 4, side effects and toxicity. And finally, number 5, crucial drug interactions. Let's get to it. So, before you stir yet another scoop of powder into your morning smoothie, we really need to answer a fundamental biological question. What is actually happening inside your body, literally at a cellular level, when you introduce this plant into your system? Because spoiler alert, it's not magic, it is pure pharmacology. All right, section 1. Meet panax ginseng, botanical origin. To really get a grip on the pharmacology, we have to start at the root. Literally, we're looking at a wildly potent member of the Aralaceae family. And here's a fun fact for you. The word panax actually translates to all healing in ancient Greek. Pretty bold name, right? If you consider the iconic, almost human-shaped root right in the center, well, that is exactly where the active compounds are concentrated. This blueprint lays out the whole shebang for us today, detailing everything from its chemical constituents at the very top all the way down to its medical contraindications.
Moving right along to section 2, the science of ginsenosides, the chemical keys.
Now zooming way in on the molecular level, we discover the precise compounds that actually give ginseng its punch. We aren't just talking about a generic extract here. We're talking about highly specific, biologically active molecules called ginsenosides. Think of these active constituents, specifically RB1, RG1, Re, and Rho, as tiny chemical keys. Each molecular structure is perfectly shaped to insert itself right into your body's cellular receptors and unlock very specific biological responses.
And man, when those ginsenoside keys enter your bloodstream, they go straight to work. They actively modulate your HPA axis. That's your hypothalamus, pituitary, and adrenal system, which is basically your body's master stress control center. But they don't stop there. They also trigger vital neuroprotective pathways to shield your brain cells, they kickstart your immune system's defenses, and they spark antioxidant pathways to fight off cellular damage. We are talking about a massive, multi-system biological intervention here.
Okay, section 3, clinical features and uses, plant to patient. So let's look at how these microscopic mechanisms actually translate to macro-level clinical applications for real people. It's incredibly structured, honestly like a straight line. Because of its anti-fatigue properties, it directly treats physical and mental exhaustion. Through cognitive enhancement mechanisms, it targets cognitive decline, specifically helping out with memory and focus. Then you've got the immune modulatory and antioxidant pathways, which directly treat stress-related disorders. And this is fascinating. Its hypoglycemic effects, which influence insulin sensitivity, are clearly linked in the clinical data to treating erectile dysfunction. It's just a perfect cause and effect relationship between plant chemistry and human health.
What you should really take away from all this is that panax ginseng has targeted clinical applications extending far beyond just a generic energy boost. Grounded strictly in the science, the data shows targeted utility for some pretty complex, serious conditions. We're looking at a substance with genuine medical utility for everything from severe stress-related disorders to age-related memory decline. It absolutely demands to be taken seriously.
Which brings us to section 4, side effects and toxicity, the risks.
Because it demands that level of respect, we have to objectively examine the risks. Look, this isn't some harmless plant where more is always better. Not at all. Mild side effects can include insomnia, random headaches, or GI issues like diarrhea. But pushing the limits, that leads to severe toxicity, officially termed ginseng abuse syndrome. This severe reaction presents with dangerous spikes in blood pressure, hypertension, and severe fluid retention, known as edema. Those little chemical keys we talked about earlier, they will dangerously overactivate your systems if you misuse them. And that leads right into section 5, crucial drug interactions, the danger zone. Understanding those severe risks makes it absolutely vital to map out our final area of focus, drug interactions. If a patient is on immunosuppressants, say after an organ transplant or for a severe autoimmune condition, or taking MAOIs for depression, introducing panax ginseng creates a highly volatile and potentially dangerous pharmacological clash. Because ginseng so actively modulates the immune system and neuropathways, it can directly counteract or even dangerously amplify these powerful prescription medications.
Furthermore, its use is strictly contraindicated for a very specific list of individuals. Basically, if you have an autoimmune disease, stimulating your immune system with ginseng is literally the last thing you want to do. It's also contraindicated for pregnant or lactating women due to its widespread systemic effects. And crucially, because of how it interacts with the blood, anyone with bleeding disorders or anyone taking blood thinners and anticoagulants like warfarin or aspirin has got to avoid it entirely to prevent severe bleeding complications.
So our journey through this explainer really reveals a clear, undeniable truth. Panax ginseng is not just some pleasant flavor profile for your afternoon tea. It is a highly active, incredibly complex pharmacological agent with profound clinical benefits, capable of improving memory, fighting off fatigue, and modulating stress. But it carries equally serious biological consequences if it's misused, abused, or combined with the wrong medications.
I'm going to leave you with this final vital thought. Now that you know the actual science, the deep mechanisms of action, and the severe contraindications, will you start treating your herbal supplements with the exact same respect as your pharmacy prescriptions? Because trust me, your body certainly doesn't know the difference. Thanks for joining me on this explainer, and remember to always keep questioning what you consume.